I'm Dr. Nicole Saphier. I'm a radiologist at Memorial Sloan Kettering in New York City, and then some of the satellites in New Jersey. My specialty is breast cancer, imaging and diagnostics, but I also do a lot of the head and neck biopsies, thyroids, lymph nodes, all of that. So stay pretty busy. But my overall mantra is early detection. So that's kind of what I've focused my profession to.
I noticed too, when I was listening to your book, I purchased it on Audible, and I'm really enjoying it. I'm probably about 3/4 of the way through, but I've been following you for a while, since I think back when, probably around election time, I think, when you were on Fox a little bit more. And then as COVID has become more and more part of our society, I saw you on there more. And I know Dolores, because she helped us with our Women's Day event in January, where we raised money for a homeless shelter. So yeah, it's very exciting. But what I wanted to ask you a little bit is, what motivated you to write the book?
Well, the truth is I'm a mom of three boys to be exact. And when my oldest went to college 2 years ago, I needed a way to channel some of my emotions of dealing with my firstborn going off to college. And so I thought, why not write a book? I mean, why not, And so I tried to think about, what was important to me? What did I have passions on? I deliver a cancer diagnosis just about every day. And what I find somewhat devastating is that it takes that cancer diagnosis for someone to say to me, I really want to change my lifestyle. I want to live a healthier life. And then I started thinking about, my whole goal has been for early detection of disease. What if we could actually focus on preventing disease altogether? And so when I started researching for my book, I broke down the leading causes of death and disability in the United States. I started looking about how much of it is impacting our country, how many people are suffering with these illnesses, how much is it costing our country, our healthcare system? Right. And then actually what I found the most surprising was how much of it could have potentially been prevented through simple lifestyle choices. And it's a combination of education and instilling the will and the motivation in other people's to actually live a healthier life, to not only, get rid of disease, but fend it off altogether.
My profession, I'm a nutritionist. So I went back to school at 42 to get my master's degree in nutrition.
Wow.
And thank you. And it's very hard to get people to change behavior. Mm-hmm. And I find that in my practice that people will come to me very motivated and say, I need to lose 20 pounds, 30 pounds, 40 pounds, male and female, but mostly I deal with women that are over 40, over 50. So our bodies have changed. I'm 52. Our bodies have changed, as you know. Things slow down and it's just not the same. But, people will come in very motivated, and then after maybe a week, sometimes 2 weeks, they're discouraged because they've lost maybe 5 pounds and they're thinking, why isn't this happening faster? So it's very hard. And then people want to just go eat a pizza. They're like, oh, forget this. It's not worth it. I can't do it. But I want to ask you a little bit too about, physicians. A lot of physicians still don't support diet, exercise, and supplementation to help change lifestyle, because a lot of clients will say to me, well, I talked to my doctor about this supplement that you recommended and he said not to do it. And then, they believe the doctor, which I understand because there's years and years of schooling and practice. I understand that. But sometimes there are very good supplements and lifestyle modifications that you can make to help change someone, but they don't want to make the change. And I'm curious because you addressed it in the book about personal responsibility. So
that's right. And if I'm sure you've heard, but in the book, I also talked about a couple of things that you just touched on. First, the whole concept of instant gratification. Like, we want something and we want it right now. Right. And so if we're not seeing results this week or next week, then we give up, because everybody's looking for the quick fix to everything these days. And so unfortunately, the quick fix is not what's best for you long term. And so it does take more of a time commitment and more of an effort, and you can't be discouraged. So that's why it's so important to have someone like you who's constantly there motivating. But it's also important to extend that to their family to make sure that they do have that support system, because nothing that's worth it is going to be fixed quickly. You really want to work for it, and just imagine how proud of yourself you'll be after that long-term goal is met. Now, when it comes to physicians, yes, we also talk about that in the book, saying, right, physicians don't really talk about lifestyle, but why is that? There's a lot of reasons why that is. In my opinion, a lot of it is because of the administrative oversight has us kind of watching our clocks and checking all the little boxes on the computer that we don't have time to get into lifestyle. We just say, what's your problem? Let me fix it. It's a reactive way of practicing medicine. And unfortunately, we have such time restrictions that it's really hard to even have the conversation of preventative measures, which is why we depend on people such as nutritionists and dietitians and a plethora of other specialists to really help the well-rounded approach. You know, a physician, although in my opinion should be all-encompassing and should be doing all those things, it's really not practical right now to believe that they're going to be able to do all that as long as there's so much administrative oversight, whether it's from the government, from the health insurance third parties, who you name it, but everyone's kind of making their way into that doctor-patient relationship, and it's really, in my opinion, broken that relationship. When it comes to certain supplements, I'll be the first to admit that sometimes I say, no, the best thing you could possibly do for yourself is eat a healthy diet,
Right.
you know, more towards the Mediterranean side. You know, some people really like, you know, like the paleo and the keto and all that. But in my opinion, restrictive diets are really hard for the long term. And so when you start looking at, you know, what has been successful for decades upon decades, you know, that's more following like a Mediterranean diet, something that's a little bit more manageable and easy to follow. But it also includes physical activity as
Right.
well as social connectedness. But especially in women, as they continue to get older, they actually need some supplements because their body stops making it. And that is an important conversation to have, not only with your physician, but your nutritionist or whoever you want to seek support in. And it's important that everybody kind of gets on the same page. And the truth is, doctors don't know everything, especially when it comes to nutrition. And that's unfortunately the first thing we have to admit is we're really good at diagnosing and treating disease. But when it comes to preventing it, it's not really our strong suit.
It was interesting because this year, well, I'm 52. I was supposed to have my colonoscopy at 50, but time flies really fast.
Well, now they've upped it to 45. So now you're really behind.
Yeah, well, I did do it, so I'm good now. I'm good for 6 years.
Good.
But it was interesting. I really respect my GI doctor. But when I was talking to him and I told him that I was a nutritionist because we were talking about lifestyle and eating and all that, and he saw an article that I wrote in a publication. He's like, "Oh, I saw you. You know, I saw you in a publication." So that was pretty exciting. But we talked a little bit about nutrition, and he said, you know, if more people listen to you, I'd probably be out of a job, or I would have way less patients. And, you know, we started talking about nutrition and whatnot, and he just said, you know, we don't really go down that road with our patients. And then I had talked to his nurse practitioner when I went back for my follow-up, because I did have some polyps removed. I'm fine, but it was good to do it. And now I know I'm healthy, and I go back in 6 years and have another one. But even the nurse practitioner said, you know, we get a lot of questions about nutrition and we just don't know how to answer them. So it was a great lead for me because I was able to leave them my business cards. But I just found it very interesting that, you know, that a GI doctor really doesn't even address that with his patients when he's doing, you know, colonoscopies and all other kinds of, you know, diagnostic testing on people that have intestinal issues. So I guess I'm always surprised by that a little bit, but your point makes sense. I mean, they're just really busy treating and helping and trying to take care of the symptoms and the problems.
Well, when you think about it, over 60% of American adults actually have some form of pre-existing chronic illness, which is coming into the spotlight right now as we're dealing with COVID. We're seeing how vulnerable we are as a population because how sick we are.
Right.
When you have that many Americans who already have an illness, yes, the physicians are overwhelmed at this point, which is why physician burnout is at an all-time high. You have fewer people applying to medical school. Suicide rate amongst physicians is higher than that of veterans each day. And it's not surprising because there's so much disease. But unfortunately, who's going to stop it? And there isn't one person like really taking the lead on that, which is the entire crux of my book, is I'm trying to empower Americans. Like, no one's going to fix this for you. And you can't actually demand someone to have a quick fix for you. Like, you have to actually take control of your life. I mean, we all have our freedoms, but with freedom comes responsibility, and you need to be responsible for your own individual health, your family's health, and that in turn will improve your community's health.
Oh, absolutely. And it's interesting because I wanted to bring up this point. I read some studies and some research on COVID and with people that are obese.
Mhm.
And I know we don't hear a lot about it on the news because it's probably not maybe politically correct to say, you know, obese or overweight or label people. And I understand that. But there is a significant amount of information that a lot of the people that died or fell victim to COVID were people that were obese, because I read one article that said they literally come into the emergency room and a lot of them don't make it because their bodies just can't handle it.
Well, and
So,
so first of all, I've written a couple of op-eds about COVID and obesity, and you're right, it's a very fine line because it's really easy to sound like a bad guy and be accused of fat shaming,
right,
especially when you have someone who's not overweight speaking about it. And the truth is, we go into obesity a lot in my book, as you know. There
yes.
are some genetic causes why people can be overweight, but the far majority is lifestyle. Oftentimes that translates from childhood. These are the behaviors that you were taught as a child. And it's really hard to go from being an overweight child to a healthy adult. And so, you know, there are a lot of factors involved, but the bottom line is excess body fat, you know, just being overweight or obese, those adipose or fat cells actually cause systemic inflammation throughout your entire body, which lessens your immune system. So obesity in itself at this point is considered a chronic disease. It's not just that, oh, obesity is related to heart disease or diabetes or metabolic syndrome. Obesity itself is weakening your immune system and is its own chronic illness. And unfortunately, the United States leads the world in obesity. And unfortunately, that's not one race that we are proud to admit that we're winning.
There was also in that same article, it talked about Vietnam as you know, that their death rate was much, much lower. And there was one other country where the death rate was lower because their obesity numbers are so low. The people tend to be slender and a little more fit. So it was just very interesting, but you don't really hear about it much on the news. They don't tell you that. And I think it's important for people to understand, like you said, obesity affects everything. So, I mean, heart disease, high blood pressure, metabolic syndrome, all that. So,
where unfortunately, physicians specifically, there are papers after papers coming out telling us how we can approach obesity with patients. And we're told we're not allowed to say these words, because it could upset them. And it's a very fine line between hiding behind political correctness and actually trying to get the message across to your patient. And we're not doing anybody a service if we're not facing the truth. And the truth is, we're all overweight. Most of us are. And why is that? You know, I talk about why I feel that we've gone overweight. And one of the main reasons is women, we've gone back to work over the last several decades. I work full time. I have 3 kids. We're not cooking every night like we used to. And if we are, we're trying to rush through it. So it's not this fresh produce and lean meats that, you know, we probably should be cooking. But all of that has contributed to a bit of an overweight society. And it's just our need for, I mean, we're all working hard. We're not being lazy.
no.
We're just trying to make our lives a little bit easier. And with that, unfortunately, comes some unhealthy choices.
And I noticed too in the book when you're talking about exercise too and making it part of your daily routine. And it's interesting because, as you said, we're all back in the workforce. I mean, I work for myself, but I mean, I'm busy all day long. Sometimes I'll sit down and it's 8:30 and I'm like, where'd the day go? But you have to find those pockets where you can get exercise. So like you said in your book, you know, take a walk. I think you said walk around your parking lot if you work in an office building a few times. Or what I try to tell my clients is, you know what, maybe you need to get up a little bit earlier in the morning. That's what I do. I get up at 5:30 a.m. I do some fasted cardio, which I want to get your thoughts on. And then I shower, I eat breakfast, I prepare for my day. And at some other point in the day, I'll do my weight training. Whenever I can fit it in. When I get an hour, I just I'll hit the gym and do my workouts. And at least, like, I have to do it now. It's like brushing my teeth. If I don't move, I don't feel right. I feel sedentary and I just feel uncomfortable, and you just don't feel happy, good. It's endorphins.
You need your release of endorphins. That gets your day going. And once it starts being incorporated into your daily routine, it becomes as easy as you mentioned as brushing your teeth. But those first couple of weeks of doing it are pure torture.
Right.
And so when you're not seeing those immediate results, you wonder why you're doing it. But the point is, you're doing it for the long-term benefit, not in the short term.
So I am a big fan of fasted cardio, and I try to get all my clients to at least do, even if it's 15 minutes, 20 minutes in the morning, before they, once they get up, just sort of get the sneakers on, either go outside, or if you have a treadmill, whatever it is, just get on and do something. I've read, there's pros and, some people believe in it, some people don't believe in it. I really believe that, and there is some research to support it, that you're forced to burn what you have stored already because there's nothing in your system. You've taken in no fuel, so you're not using that as your energy source. I'm curious what your thoughts on that. Do you believe that fasted is beneficial, or it really does? I mean, it really doesn't matter. Just get it in when you can, or.
So for me, I believe your diet has more to do for you than pretty much anything else, but you also need the physical activity coupled with it. So I do enjoy the state of fasting. I think that is a very beneficial state for your body to be in. I'm a huge proponent of intermittent fasting. I follow it myself.
Okay.
It's kind of what works for you, but I think that short burst of cardio in the morning after a period of fasting is crucial to getting your body going. And, we're not all going to look like you. We are not all going to be these beautiful fitness models. But the bottom line is, if you're doing more than you're doing now, that's great. That's a step in the right direction. So whether you're just getting up, you're doing some jumping jacks or even some push-ups, whatever you need to do to get your heart going. It doesn't mean you have to go and jog 2 miles at 5 a.m, because the truth is most of us can't do that.
Right.
If you're just getting up and you commit to 15 minutes of doing something to getting your heart rate up,
right.
That's a great step in the right direction. That's not only good for your physical health, but your overall mental health. And you've already kickstarted those hormones in your body to last you for the day.
And I think exercise overall, and I know you'll agree, definitely helps you deal with pretty much any stressful situation. Because I feel like when you're kind of sound and solid within yourself, like no matter what comes at you, it's like you can deal with it. Because I think it keeps you logical versus kind of, going off the deep end or getting really emotional about things. I think it really makes you think about, okay, how am I going to handle this? Or, what's the best course of action?
Well, and not only can it motivate you, like if you're feeling down, it can motivate you, but if you're worked up or if you're upset, it can actually calm you. So it has many different benefits, and, it's really great for the emotional aspect of things. And so people who are finding themselves feeling more anxious, feeling more depressed, it's harder to start exercising, but once you do, those feelings that accompany exercising really can help in the mental health aspect.
I'd love to have you share a little bit too about your personal journey, because I think, well, I know a lot of times as women, we tend to look at other women that are successful or have achieved, some kind of physical goal or something. People sometimes will say to me, oh, well, it's easy for you to work out. Well, actually, I have to push myself too at times. There are times when I just want to lie on the sofa and do nothing. But those are the times when you have to really dig deep to get up and get moving. And sometimes I'll trick myself and say, okay, just do 10 minutes. And if you still feel like you don't want to do it, be done. But usually once you're like 5 minutes in, you're like, okay, I got this. I'm going to keep going. But, we tend to look at other women and think it's easy for them. It's easy for you. You're a beautiful doctor. You're young. You have a beautiful family. People do that. I could never do that. I could never have that. And they negative self-talk to themselves. But your journey was not so easy. And I'd love it if you could share a little bit about,
Sure.
you talked about being a teenager and what happened to you and all that. So.
Well, not that anything happened to me. My choices led me to make a very difficult decision when I was 17 and I got pregnant between my junior and senior year of high school. And, I was faced with the choice of, was I going to have a baby or was I not going to have a baby? And, I had one half of my parents saying, you can do anything you want. The other half saying, you'll never be a doctor if you go through with this. And, I did end up having my son when I was a senior in high school. And, I found myself always trying to prove something to someone because people said I wouldn't be able to do it. So we went straight to college and then straight to med school and then internship and then residency and then fellowship. And I've just been consumed with this. How can I prove myself to the world? And unfortunately, I still feel that. And rather than turning inward and being proud of accomplishments, working at a world-renowned cancer center,
Right.
Winning awards, being on TV as a healthcare policy pundit, having a book come out that was a bestseller. But I still am like, okay, well, what's next? What am I doing next? And the bottom line is you want to actually be focusing inward to not what's your next goal, like what are these material things that you can do, but are you actually focusing inward on yourself? And for me, that's one of the hardest things for me is I actually hate exercising. And it's because I was a gymnast. And so I've had my shoulders worked on. I've had both rotator cuffs repaired. I've had 3 ACL surgeries.
Wow.
I also have an autoimmune disease, which I take injections for. So I have bone pains. So my body hurts and it hurts all the time. And so exercising for me is not fun. And I found myself, I need to do something. And so for me, I found intermittent fasting, and I felt great with that. But you can't, it's not just diet. You have to have some physical activity. And I'm not the person to go to the gym. I don't enjoy the gym, nothing about it. I don't know if it just brings up memories of gymnastics or what it is. But I have found my own routines in the sense that I like to do things just in the privacy of my bathroom. Like, I don't want anybody else knowing that I'm working out. You know, I've come up with this little home routine that I like just fine. And, you know, I'm okay that I still have a little extra weight on my hips because I've had 3 kids, and that's okay. You know, as long as I like the way I look in clothes, I'm perfectly fine with that. I think it's just working on getting to a place that you like yourself. If
Right.
something bothers you, fix it, you know, but don't just do it for the cosmetic purposes. I want to make sure that people are doing it for the right reasons. And the right reason is because you want to live a healthier life. You want to be there for your family, and you want to enjoy your life. You don't want to just be, you know, surviving.
Why do you think as women, we tend to default to negative self-talk? Why do you think a lot of women are like, you know, I'm not thin enough, I'm not pretty enough, or I need to have this fixed or that fixed or this injected or that lifted? Like, why do you, and it just seems like that's what we default to, instead of going, like you said, I like myself, I'm pretty, I'm smart, I'm accomplished, I'm, you know, all these things, but we go the other way.
Well, I mean, we live in the era of social media. I touch on this a
So,
bit in the mental health chapter of the book, saying, I mean, if you look to the Kardashians, who have
right,
taken what body you've been born with as just a suggestion. And so when that is your new normal, and that's blowing up everyone's Instagram feeds, and everyone's putting their best life forward on social media, which we know is not reality, it leaves us second guessing ourselves as parents, as educators, as professionals, and just in our overall appearance. And all of a sudden you think that everybody looks like this airbrushed whatever. And the truth is, it's not true. But we want to look better, but, you know, women just innately are a bit more, I would say, I want to say that, you know, they're a little bit more insecure, but I think men are actually quite more insecure than women sometimes. But I just think that we tend to look to others to compare ourselves. So if it was just you, you would probably be pretty happy with yourself, or you may be able to acknowledge a few things that you might want to work on. But because we're constantly being compared to others, it makes it much worse. And that has just ramped up with social media. And, you know, I am perfectly fine with plastic surgery. You know, I've had Botox before. It's about all I've done, but I'm fine with it because I do everything I can to make
right,
myself look as good as I possibly can. And there's still a couple things that bother me. So now I'm going to do it. But you don't want to start with the plastic surgery. You don't want to start with all of these other external ways of bettering yourself. Try and do it from within. Get yourself to the best possible state you can, physically and mentally.
right,
And then if there's something that still bothers you, then go to the plastic surgeon. I mean,
right.
they have payment plans, whatever you got to do, but work for it first. Don't just run there. That's, again, that easy way out. And there's never going to be an easy fix to anything that's going to be long lasting.
Yeah, going back to that instant gratification, because I'll even have clients say to me that are trying to lose weight, you know, should I use a fat burner? Should I do this? Should I do that? And I'm like, you know what? Let's just let the diet work.
Yeah.
If you can give me like 4 solid weeks of compliance, let's see where we're at the end of a month. And then, you know, we can talk about if you want to add other things in, but let's just let food and like just some general kind of movement, let's see what happens. Yeah. And you're right, usually, or almost always, it's when you change someone's diet and they'll adhere to it, they'll start losing weight. Because sometimes if I get someone that is very overweight that needs to lose 70, 80 or more, you know, sometimes I'm like, you know, we can add the extra, you know, walking is awesome, let's do that. But like, we'll add the weights and some other things down the road. But let's start right now with just getting a good eating plan underway. And getting,
and the thing with that is why that's so important is because when you start eating better, that's just better for your overall health, not just shrinking your waistline. A fat burner is actually going to cause anxiety, can cause some effects on your health, on your heart, so cardiovascular system. You want to try it to do as naturally as possible. But at the end of the day, genetics do play a role. And so if after time you're doing everything right and you still need help, that doesn't mean you're a failure. It just means that your body's working against you and you need a little help.
Right. No, absolutely. And I totally support that thought too. I'm curious, how do you do your intermittent fasting?
So I do the, the 18-6? No, 12 to 8. I eat 12 p.m. to 8 p.m.
Okay.
And so 16/8.
Okay.
So from 8 p.m. until 12 noon the next day, I just drink water, I drink black coffee, and then from about 12 p.m. to 8 p.m., I kind of eat, I'm not going to say whatever I want. I eat a relatively healthy diet. But I have a few snacks in between. I really love the savory seaweed strips that you can get because I'm much more of a savory than a sweet person.
Okay.
And this is usually when I'm at work throughout the hospital. I try and have green tea with turmeric in it or some ginger in it, because not only does that give me some antioxidants, but those are also immune boosting properties, anti-inflammatory properties, and actually just really makes you overall feel well and can have some benefit in terms of anxiety and just mood depression.
Now, have you felt nervous at all about getting COVID, or like, have you always, I mean, you're a doctor, so you're very logical and smart and scientific, but emotionally, did you ever have any of those moments of like, I don't want to get this, or, being kind of nervous being in the hospital every day, or?
Well, so as I mentioned, I have an autoimmune disease. I take injections for it that suppresses my immune system.
Okay.
And so when you talk about some of the more vulnerable, I'm one of them. So I did have a little bit of nervousness there. And I want to be around for my kids. I still have two young guys at home. And so I've just done everything as smartly as possible. I work from home when I can. I have a full reading station in front of me right here. I do TV from my home as well. I haven't actually left my house much. I go into the hospital a couple days a week. But so when I'm doing biopsies, though, they all have to have negative tests and I'm wearing proper PPE. You just have to work through some of that anxiety. As long as you supplant facts, that'll quell fear. And so the more I know about it, the more I learn about it, the less fearful and anxious I am, because intellectualizing is a great way to get through certain circumstances.
How long do you think it's going to take for us to sort of get back to normal, like where we were prior to March? Like, how long do you think we're going to be wearing gloves and masks and distance 6 feet away and all that? Do you think it's going to be throughout the rest of the year, into next year?
I don't think we're going to ever go back to exactly how it was pre-COVID. I think we've learned a lot of very valuable lessons here. I think it will take until we have a proven treatment and or vaccine until we really see loosening of restrictions, unfortunately. And that's not going to be until late 2020, early 2021. So for this next flu and cold season, we get it every year. Mm-hmm. I think it's going to be flu, cold, and corona season. And since we, again, don't have a treatment for it, we don't have a vaccine for it, we all have to still be hyper aware. Now, does that mean that everything needs to stay shut down? No, but employers are going to need to figure out ways to keep their employees healthy, make sure patrons feel safe coming into their establishment. Kids still need to get back to school because that socialization is crucial for their development.
Agreed.
They need to come up with some smart ways about doing it. And if you start seeing clusters of cases, then small areas are going to have to go back to social distancing again. The whole point is to protect our vulnerable. So if you are someone who is considered high risk, or you live with someone who is considered high risk, you have to do everything you can to protect yourself and protect those around you. But that being said, we also have to make sure that we're still living our lives, because if we're just hunkered down in isolation, then that's not really living life either. And what's the point of doing all this?
Well, I've read some other research also too about certain blood types being either not necessarily immune, but maybe having it's harder for those blood types. I think it was O blood types that I read. And we haven't heard a lot about it because they said that they don't really want to put it out there because they're afraid that people that are O blood types might be like, hey, I'm immune, and they can just do what they want to do. But
when you have O blood type, that means your body makes antibodies to the other blood type. So your anti-A and anti-B antibodies. And so what they have found in the past with malaria is O type blood types tended to be relatively immune from malaria, and they are thinking that it's possible with the coronavirus. It's kind of the same thing as we've seen anti-malarial medications. There are some reports that they're also working on some coronavirus cases. The whole point is, how your body responds to the virus. So if you do already have circulating antibodies, then maybe it does give you some immunity, but there is nothing proven about that. So no, if you have an O blood type, that doesn't mean you just go frolic around and do whatever you want to do. Because the bottom line is, although you may feel well, you still may be an asymptomatic carrier who can then transmit it to someone else who can have a fatal response to it.
Now, say, could someone like me go and have a blood test to see if I have antibodies or see if I was exposed but just didn't get it? Like, are they doing that yet, or that's not?
They are doing that. It's in various places. New York and New Jersey are doing it. You can always call your primary doctor. They
Okay.
probably won't know, but certain places of employment are doing it. Public health officials are doing it. Some hospital systems are doing it. So if you're already plugged in with one, you could always call there and say, hey, are you guys doing these things? But it's important to remember that just because you have antibodies to this coronavirus, we are thinking that it means you're immune to a future infection. They don't actually know. So again, we're still dealing with this best guess scenario.
And if they do, or when they do come up with a vaccine, will they, is it going to be just like a one-time vaccine, like when you get like the measles, mumps, rubella vaccine or polio, or is it going to be something like a flu shot where you have to do it every single year?
We don't know, and we won't know. Right now, they're thinking it's going to be a one-time only, but we're already seeing multiple different strains of this coronavirus. So it'll be interesting to see if, a generalized vaccine works for the different strains. We know with the flu, that's not the case. We know we have to change it every year based on the pattern of the different strains of the flu. My gut tells me this is going to be similar to the flu because it tends to mutate a lot. But again, we don't really know. And that's the best answer we can give right now. And anybody who tells you otherwise is wrong.
And so just to switch gears a little bit, I work with midlife women, women over 40, over 50, who are either perimenopause or menopausal or beyond it. And one of the biggest questions, or one of the biggest complaints I get, well, there are two actually. One is sleep, that a lot of them just aren't sleeping the way they used to sleep, or their sleeping's interrupted, or they're a little anxious before they go to bed, or they're waking up in the night, and it's not always because of waking up with hot flashes or feeling warm. Sometimes they're just waking up and they can't go back to sleep. I'd love to just sort of get your take on that as a physician.
Well, there's a lot of different reasons for interrupted sleep, especially as you go older. Your hormones change, your circadian rhythms change. The bottom line is you want to do everything you can to mentally and physically quiet down before you go to bed. A lot of people are glued to their TV or their phone or whatever it is. And a big thing is digitally shutting down 1 to 2 hours before bed really helps. Not eating or not drinking right before bed really helps. I mean, people think that drinking alcohol helps them sleep. And they're right that that can make them fall asleep.
Right.
They're much more inclined to have interrupted sleep and then wake early and not really have restful sleep. So you have to think about the time before you go to bed, like those several hours of just like really preparing your body to rest. And so you don't want to bombard it with overstimulating things such as alcohol or tobacco or nicotine or caffeine or mental stress, visual stimulation, any of that stuff. Think about your pre-bedtime routine as a way to prepare for relaxation, almost a pre-meditation.
Right.
And then exercising during the day obviously will help you rest better at night.
And then, so you brought up something which is a great segue right into what I wanted to ask you. I don't drink alcohol. I did prior in years. My kids were smaller and they'd go to bed at night. I'd have a glass or two of wine. And I did that probably for a few years. And it wasn't until I got into my 40s when I started really weight training more and started to compete that I stopped, because I had to. When I was trying to lean down, alcohol was not part of my contest prep diet. So, but once I stopped, I never missed it, and I felt so much better. But a lot of women are drinking every night 1, 2, 3 glasses of wine, and I know this because they tell me. So, my goal is always to get them. I can't get them to like cold turkey stop, because they look at me like, "Are you out of your mind?" Or I get the dead pause on the phone when I'm talking to them. But what I try to do is say, okay, maybe during the week we can just cut back, or maybe save a glass for Friday night and a glass Saturday night, and let's try to like pull it back. But I'd love, as a doctor, if you could just address a little bit of the health ramifications as far as liver not doing what it should be doing, and then estrogen starts to pile up, and then what that opens us up to, and just how it's just kind of not good for us because it is toxic.
Well, sure. So drinking alcohol, although there are nominal benefits, such as some antioxidants, if you're drinking red wine, the bottom line is there's really no health benefits to alcohol, and it's quite toxic from the moment it touches your lips all the way out. It increases the risk of esophageal cancer, stomach cancer, liver cancer, bladder cancer. I mean, there are a lot of things that it's toxic, and that it is what it is. You know, it gives some people, you know, it allows them to relax a little bit. Bottom line, I am someone who still drinks alcohol, but when I was making this decision to live a healthier life, I decided, okay, well, what can I do? I did some research. I really do enjoy having a cocktail with my husband after the kids going to bed. So I've switched to a Blanco tequila. And I've never liked the flavor of tequila, but tequila in itself is low sugar, low carbs, and your body doesn't actually absorb the sugar. And so you don't get that blood sugar spike that you do with other alcohol. But it's by no means good for you. And it's not something that you should be doing if you're doing it to relax, because it is toxic for you. And if you're finding yourself needing that glass, then there's a bigger problem. Not that you're an alcoholic, but that you need to find other ways to cope with your stress and everything else going on. It should really be for pure enjoyment, not because you need it. Right. And bottom line, women should not be having more than 1 to 2 glasses of alcohol 1 to 2 days a week. Any more than that drastically increases your risk of breast cancer, liver cancer, and many other things, as well as increased fat deposition. And that itself increases your risk for other cancers. I mean, in those fat cells that we've talked about, yes, they cause systemic inflammation, but they also release estrogen, and estrogen can increase your risk of other cancers.
Right. Well, thank you. I know you're a busy woman, so I really appreciate your time. And
absolutely, this was wonderful.
I wish you all the best, and I love watching you on Fox. It's very exciting.
Thank you.
I'm like, I talked to her.
That's what they're here for. I'm shooting a Mother's Day special well wish right now.
Awesome. And one more just quick question I want to ask you personally. Can I reach out to you though? I'd love to just ask you a couple more questions. And
yeah, sure.
All right, I'll send you an email.
Great. Thank you.
Thank you, Dr. Saphier. Have a great day.